Hello everyone, welcome back to Diagnosis Diaries. Today we will discuss a new case study of a 55-year-old man named John Smith. John Smith presents with persistent chest pain and shortness of breath. Let's take a look at his medical history. Hypertension, high blood pressure, diagnosed 10 years ago, managed with medication. Hyperlipidemia, high cholesterol, diagnosed 5 years ago, managed with statins. Former smoker, quit 5 years ago, smoked for 25 years. Family history of coronary artery disease. Father had a heart attack at age 60. Present symptoms. John Smith complains of ongoing chest pain that radiates to his left arm, associated with shortness of breath, particularly during physical activity. He also reports occasional dizziness and fatigue. This was his physical examination counts. Blood pressure, 150/90 mg, heart rate, 85 beats per minute. Respiratory rate, 18 breaths per minute. Nejm, 30. This was his diagnostic tests. Electrocardiogram EG showed est segment depression in leads EE, IE, and OFF, suggestive of myocardial ischemia. Echocardiogram revealed left ventricular hypertrophy and regional wall motion abnormalities. Lipid profile, total cholesterol, 240 mg, LDL cholesterol, 160 mg, chidal cholesterol, 40 mg, triglycerides, 200 mg. What will be the diagnosis of the patient according to you? Take some time to think and see if you are right. Diagnosis. Based on the patient's symptoms, medical history, physical examination, and diagnostic test results, John Smith is diagnosed with stable angina pectoris due to underlying coronary artery disease, CAT. The AG changes and regional wall motion abnormalities on the echocardiogram suggest myocardial ischemia. This are the treatment plan. Encourage smoking cessation. Advise weight reduction through a balanced diet and regular exercise. Educate the patient about healthy eating habits and the importance of regular physical activity. Prescribe nitroglycerine sublingual tablets for immediate relief of chest pain. Initiate statin therapy or optimize the current statin regimen to lower LDL cholesterol levels. Consider prescribing an antiplatelet agent to reduce the risk of cardiovascular events. Refer the patient to a cardiac rehabilitation program for structured exercise training, education, and counseling. Schedule a stress test to assess exercise-induced ischemia and determine the need for revascularization procedures. Arrange regular follow-up appointments to monitor the patient's symptoms, medication adherence, and lifestyle modifications. Adjust medications as necessary based on the patient's response to treatment and follow-up test results. That was the end of the case study. Hope you learned something new today.